Health for all means we put people first. It means we invest in equity, providing access to care and financial protection to every inhabitant of our country, irrespective of their official status. Because a country and its economy can only thrive when its people are healthy, both physically and mentally.
Health for all means affordable, accessible and high-quality medical care, modern systems of epidemiological forecasting and response, domestic productions of drug and medical products, healthy lifestyle and mass sports. Kazakhstan defined these 4 directions as our national priorities for the 5 upcoming years.
Health for all begins at home, in schools, in workplaces, and everywhere, for all people, for all well-being, by all sectors of society. No one is left behind.
Health for all means securing the highest attainable standards of health as a fundamental right of every human being, ensuring equity and not leaving anyone's health behind. Universal health coverage is a powerful mechanism for achieving better health while being in the path to promoting human development.
Health for all means ensuring diverse and equitable leadership. While women make up the majority of health workers, they are far from equal participants in decision-making. To help build equitable and resilient health systems, invest in women leaders. Our knowledge, perspectives, and equal participation in decision-making are essential to building health for all a reality everywhere, including at the front line in communities during the COVID-19 pandemic and beyond.
Health for all means a world where all people thrive and not just survive. For people and communities who are marginalized and in vulnerable situations, this is often not an option. But frontline health workers and volunteers can make a difference by providing trusted, life-saving healthcare. Without them, there is no universal health coverage.
Health for all means that countries have strong and resilient health systems to ensure health security for all and access for all to essential health care without suffering financial hardship. Universal health coverage is the foundation for human capital and economic growth and the driving force behind all of the World Bank's health investments and efforts with the countries.
Health for all means ensuring equal access to high quality, safe and people-centered healthcare services based on individual needs and with no distinction of gender, sexual orientation, race, religion, political belief, economic or social condition.
Saúde para todos significa assegurar o direito de todo cidadão a medicamentos e serviços de saúde. Aqui no Brasil, a saúde é um direito fundamental, é direito de todos e dever do Estado. Reitero o nosso compromisso com a cobertura universal de saúde. Viva o nosso SUS.
Health for all to me means that all people, in particular those affected by war and violence where health institutions have been damaged, have access to health services. In particular, those in refugee camps, those in detention, those outside of state control. We have to work together so that everywhere and everybody has access to health services.
Health for all means reaching those left furthest behind with life-saving vaccines as a pathway to providing other services. As countries roll out COVID-19 vaccines, we have a historic opportunity to strengthen routine immunization, to reach zero-dose children and missed communities with a full course of vaccines, along with primary healthcare services, and build resilience to future shocks.
Health for all is a beacon of light, freedom from inequality, a world full of hope, compassion, and peace.
La santé pour toutes et tous, c'est être solidaire et accompagner les pays dans le renforcement de leur système de santé. Chacun et chacune, peu importe son âge, son sexe, son niveau de vie ou son lieu de résidence, doit avoir accès à des soins de santé de qualité.
Health for all means saving lives by investing and providing quality, accessible, and resilient health systems to every citizen. Health for all means leaving no one's health behind.
Health for all means that health is not a luxury for those who can afford it. It is a fundamental human right. One of the best ways for countries to protect and promote that right is by putting it in their constitution. More than half of countries have done that. WHO calls on all countries to make the right to health not just an idea or an aspiration, but a legal guarantee.
Health for all means working together to build strong, resilient and inclusive health systems that work for everyone. Working with our partners, the UK has improved access to health services for around 9.5 million people in DRC and 1.3 million women and children in Ghana, and helped to halve the maternal mortality rate in Nepal. Later this month, I will launch 2 new papers that set out how the FCDO will continue our work to achieve universal health coverage and end the preventable deaths of mothers, babies and children.
Health for all means that in all countries, including my home country, Uganda, no mother will have to choose between putting food on the table and getting treatment for her sick child. It also means that adolescent girls and young women can have sexual and reproductive health services to meet their needs, and that men who have sex with men can enjoy the same health services as everybody else. It means communities in their diversity are able to contribute as planners, as implementers, and as monitors of health services.
Everyone, children, women and men, all over the planet must have access to healthcare. The disastrous impact of the COVID-19 pandemic on our societies has really shown the importance of resilient health systems. And they are key to achieving universal health coverage and health security, and should be a priority for every WHO member state.